Okay, what is photosensitivity? Photosensitivity means if you take a drug and gets exposed to the sunlight, there are chances that you get some skin reactions. The skin reactions may be mild to severe. So cutaneous reactions that results from drug-induced sensitization of skin because of UV radiation of the sunlight, that is called as photosensitivity. There are many examples, and these are erythema, edema, hyperpigmentations. Any range of skin reactions can happen, from redness to blackening of the skin, edema of the skin. Dermatitis like picture can happen because of many drugs. Then there comes terminology that is very important, that is teratogenicity. Now, what is teratogenicity? Teratogenicity is basically damage to the growing fetus because the mother gets exposed to any of these teratogenic drugs. So, fetal abnormality that develops if a pregnant mother get exposed to some of the medicines, that is called teratogenicity. Important is thalidomide disaster, where thalidomide is a drug. Thalidomide was actually around 1960s. It was available as an over-the-counter medications, and you know the over-the-counter medications, medicines for which no prescription is needed. So many pregnant women took the medicines for nausea and vomiting feeling that they developed during the first trimester of pregnancy, and eventually the babies that got birth had some abnormalities like seal limb. They had a seal limb deformities. So there were malformations with limb, there were malformations with feet. Brain development was affected, and eventually many babies died as well. So that was a big disaster, and that shook the world basically. That you need to keep watch on the drugs, and you need to keep watch on those adverse drug reactions of medicine. So that was a big thalidomide disaster. There are many examples of it. Warfarin anticoagulant medicines we use, and if you give this medicine to the pregnant females, that can lead to eye and hand defects in babies. Valproate sodium, which is being used as an anti-epileptic medicines, and that can produce neural tip defects in developing babies. And phenytoin, again anti-epileptic medicines, develops cleft lip and cleft palate in developing fetus. So, depending upon the risk of developing fetus, the drugs been categorized from A, B, C, D, and X, where A suggests the safest drug, that you can give this drug to the pregnant females. So, these kind of drugs are comparatively safest in comparison to other categories, while the drug X is the other extreme, where that these drugs are absolutely contraindicated in pregnancy. Hormones like estrogen, ergometrin, isotretinoin, these are drugs which must be avoided. Then there are few drugs which are comparatively safer. For an example, B category, where antibiotics like amoxicillin, erythromycin, and paracetamol, where study been done in animals, and in animals no risk has been found out. In category C, they having a mild risk, where no studies in pregnant mother, but benefit is greater than the risk. So sometimes the doctor takes the decision depending upon the risk benefit ratio. If a patient needs to get treated and in front of that the risk is minimal, sometimes doctor may take the chances. So these drugs are morphine, atropine, adrenaline. These are some of the life-saving medications. So saving the life is also important at the same time. So that is why sometimes you need to make a decisions of risk benefit. But this D and X, especially the X category, should be avoided. Again, the D category is a kind of thing where there are chances of risk to the developing fetus because of the drugs, and on the other hand there are chances of risk to the developing fetus because of the disease as well. For an example, epilepsy. If you won't treat epilepsy, this epilepsy eventually might kill the baby, and if you give the medicines to treat the epilepsy, they might create adverse drug reactions in baby. So doctors need to be, take chances in those kind of situations. So this category of drugs gets included into category D. So A, B, C, D, and X, D, there are different categories of drugs depending upon the safety profile. Then comes the exposure, like when in pregnant female, at specifically which point of the time this drug gets exposed and which kind of abnormality gets developed. So first is drugs that can affect the fetus at three stages. First is fertilization and implantations. So from conception to first 17 days. So if mother gets exposed to the drug for first 17 days, what happens? There is high chances that pregnancy will fail, and which often goes unnoticed. So during first 17 days, if pregnant mother gets exposed to those drugs, the pregnancy gets failed. Second phase is from 18 to 55 days. These are the phase. This is a phase called as organogenesis, where most of the organ gets developed, and this is the most vulnerable period, where if the pregnant female gets exposed to those medicines during 18 to 55 days, there are high chances that deformities are produced. And the third phase is from 56 days onwards. That is a phase of growth and development, where most of the physiological functions gets developed. So if pregnant female gets exposed during these days, there are chances of functional abnormality and developmental abnormality can occur. These are some of the example. ACE inhibitors are the medications which we use in treating high blood pressure patients, and that might produce hypoplasia of the organs like lungs and kidney. So these are the three different phases in which, if the female or the pregnant female gets exposed, different kind of deformities produce. So these are the three different phases. One more kind of adverse drug reactions, that is mutagenicity and carcinogenicity. This we have already discussed. Mutagenicity means ability of a drug to cause genetic defects that basically affects the gene, and then eventually the response gets affected. These are some of the heritable defects to the next generation as well. So there are drugs which can produce mutagenicity, and to check those, we are doing experimentations mostly on animals to check this mutagenicity. And then comes the carcinogenicity. There are some drugs which produces cancers as well. So there are some anti-cancers medicine which we use to treat the cancer, and as a side effect they produces cancer on a long-term exposure. So that is called as carcinogenicity, capability of a drug to produce cancer as well. Anti-cancer drugs itself, they are included into this carcinogenicity producing drugs, some radioisotopes, some hormones like estrogen and tobacco. So these are some of the examples of mutagenicity and carcinogenicity. Now one more terminology is iatrogenic disease. Now what is iatrogenic disease? Means physician induced disease. Means a doctor prescribe a medications for a particular disease for which the patient came for the treatment. But due to that medications, another disease get developed even after the drug gets eliminated from the body, and that is called iatrogenic disease. So any functional diseases that is arise by drug which persist even after the offending drug has been withdrawn and eliminated from the body. So this is kind of a physician induced disease, where physician gives a medication for some another disease, and because of that drug another functional abnormality gets developed even after the elimination of drug from the body, and that is called iatrogenic diseases. Example is steroid induced peptic ulcers. So if long term steroid is been taken, there are high chances that peptic ulcers get developed. Isoniazid anti-tubercular medicines produces hepatitis because of its toxic metabolites. And phenothiazine group of medications which been used as an antipsychotic drug in patients of schizophrenia or psychosis, they end up producing Parkinsonism like side effects or movement abnormalities. So these are some of the examples of iatrogenic disease. Another terminology is drug dependence. About this drug dependence, we'll talk in detail in CNS, but let's talk briefly what this drug dependence is. So WHO has defined this dependence, that the drug dependence, as the name suggests, patient or a person gets dependent on drug, and he need to now take drug on regular basis or for a longer period of time. That is drug dependence. So state arises due to repeated use of drug. If patient or a person uses the drug repetitively, with all types of detrimental effects. With all grades of craving, patient might develop craving. Patient might develop psychological and physical needs to use the drug. He gets dependent psychologically or he gets dependent physiologically, that this is the medicines or this is a drug I need to take, otherwise I will get any psychological symptoms or physical symptoms. For fear of getting withdrawal effects, if I won't get the drugs, I will be having this kind of symptoms. So this kind of fear gets developed in a patients. So this state is called as drug dependent state, that the person is now dependent on drug, you can say. Now this type of drug dependence are basically two, that is psychological and physical dependence. Psychological dependence develops first, where individual believes that you know if I take the drug then and then only I can achieve a proper psychological state. So that is called as psychological dependence. So that leads to repetitive use of a drug and eventually the compulsive use of the drug. For an example, some person might think that I need to take these medicines to work, and that is called as psychological dependence. So for better working I need to take that medicine, so that is called as psychological dependence. For example, opioids and cocaine. Physical dependence means with altered physiological state because of repetitive administration of a drug. So physiological state gets altered, and because of that continuous drug is needed in the body to maintain the proper physiological function. So if the drug won't be there into the body in particular concentration, the body will produce some physiological symptoms. So there would be some physical symptoms or physiological changes that will occur if the particular concentration is not been achieved in the body. So that is called as physical dependence, because now the body has got dependent on the drug. So if particular amount of drug won't be given in a body, the body will respond adversely. So that is called physical dependence, and initially it was called psychological dependence, that psychological state is being achieved with the use of drug. These are two kind of dependence. Physical dependence arises frequently due to alcohol and benzodiazepines, that patient might feel craving, patient might get tremor, patient might get restless if you withdraw this alcohol and benzodiazepines. So there are some other terminologies also that are quite relevant to this drug dependence, that are drug habituation, drug addiction, and drug abuse. Habituation we already know, these are comparatively less intensive, so less intensive involvement of a drug. So on withdrawal only mild discomfort. So if you withdraw the drug, only mild discomfort would be there. An example would be tea and coffee. Sometimes we get habituated to the tea and coffee. What is drug addiction? Very compulsive drug use is characterized by overwhelming involvement with a drug use. The example is cannabis. And the drug abuse, where the use of a drug by self medications in a manner and amount that deviates from approved medical and social patterns. So you are using the medicines and you are deviating from the proper or approved use of that medicine. So you are either taking in a higher amount or you are taking for another indications for which the drug is not being approved. So that is called as drug abuse. So this is how patient gets dependent. First it starts with habituation, he start taking drug and initially he feels mild habituated. Then eventually it goes into the state of addiction. Now there is a compulsion to take a drug. Then it goes into state of abuse where he deviates from the normal use of a drug. Either he uses the drug for longer period of time or for another indication or for in a higher doses, and eventually it develops psychological dependence, that particular psychological state needed for the work only if the drug has been provided. And eventually the physiological dependence, where if the drug won't be provided to a person, there are chances that body will respond adversely. So this is how the process of drug dependence produces. Drug withdrawal reactions means now the patient is drug dependent, and if you suddenly withdraw the drug or if you suddenly won't provide the particular drug to the person, what happens? These are called as drug withdrawal reactions. So adverse consequences that arises due to sudden interruptions of the therapy, and these kind of withdrawal reactions, as we have seen in ADR section, are quite common with some medicines. For an example, steroids, it is extremely common. If steroids being prescribed for longer times, more than 15-20 days, now you need to gradually withdraw the steroids. You cannot just abruptly stop the steroids. If you have taken the steroids for 30-40 days, now you need to gradually stop the steroids. So if you have taken steroids, for an example, higher dose of 40 mg, now you need to gradually decrease the steroid dose for like 35, 30, 20, and eventually you go to the 5 mg and eventually stop the steroid. If you abruptly withdraw the steroid, there are chances of acute adrenal insufficiencies, and there are side effects that body produces because of this sudden withdrawal. Same way, we already seen the example of clonidine, which is an antihypertensive medications, and if you use this medicine for longer time and suddenly patients forget to take that medications, there are chances that severe hypertensive episode might come and hypertensive crisis might occur. Same way, beta blockers are the medicines we use for treating the high blood pressure, and suddenly withdrawing beta blockers might lead to angina pectoris or severe chest pain. So these are some of the examples of drug withdrawal. So in a nutshell, we have already seen different kind of adverse drug reactions and their subparts. For an example, side effects, secondary effects, and toxic effects we have seen in type A adverse drug reactions. Then idiosyncrasy, drug allergy, we have already seen in type B adverse drug reactions that were bizarre. And photosensitivity, exposure to sunlight, drug dependence, drug withdrawal reactions. What is teratogenicity? That is exposure to the pregnant female of the drugs, and that might lead to fetal malformations. Mutagenicity and carcinogenicity, development of genetical changes and cancers. Heterogenic diseases, that physician induced diseases. Let's talk about last part, that is prevention of adverse drug reactions. How we can prevent those adverse drug reactions. So first of all, avoid inappropriate use of the drug. So rational use of a drug is important. We already discussed that is rational use of medicines. Use in appropriate dose, route, and frequency. Take into consideration about previous history of medication. So asking the history of drug reactions, previous history of drug reaction is very important. If the patient having an allergy to particular class of medicines, always ask. So do not prescribe those medicines. For an example, there are some group of antimicrobials to which the patient develops allergy. So if you ask the patient and patient say, yes, I do have allergy to this kind of medicine, so never give medicines from this particular class, choose another class of medicines. Rule out the possibility of drug interactions. There are chances of drug interactions, and that eventually might lead to some adverse drug reactions. So make sure you are not missing those drug interactions. Adapt the correct drug administration technique. There are chances that because of some faulty technique also adverse drug reactions get developed. Appropriate laboratory monitoring. Appropriate laboratory monitoring is also needed for prevention of adverse drug reactions. So this was all about adverse drug reactions. Hope you understand things. If you have any doubts, just comment in comment sections. If you haven't subscribed to our channel, subscribe it. We will always upload new videos almost every 2 or 3 days, so that you get updated about that pharmacology. Thank you very much.